the people in the institutions, especially those who were not sick, and doing some other works like those in agriculture, those in even healthcare, and so on. I assume that all that was implied in what he was doing. There are people in the ports and harbors doing all kinds of work involving musculoskeletal problems and so on. These are not the ones who will normally come to hospital. They are outside. They will be looked after by the occupational health unit. But the important thing, as far as I'm concerned, is that, see, there's so much poverty in this country, and so it is in other parts of Africa, where oil has been discovered. And we in Ghana ought to make a difference. This is what everybody is saying, that it is important that our oil find should be prudently managed, commercially, legally, in every other respect, so that we do not go the way of the Niger Delta or elsewhere. Because if you look at the picture throughout Africa, poverty, there is much poverty in countries where oil flows. All aspects of disease in the oil industry, while engineers and scientists study the quantification and root causes of events. Yet, among the professionals who play an important role in the health, safety, and environment are specialists known as occupational hygienists. And these may be engineers, chemists, toxicologists, physicists, physiologists, economists, biologists, and scientists in related disciplines. To prepare yourselves to take advantage of the position that the industry will create in this country in the near future for you. When the day dawns, I am certain that the Ghana Association of Quasi-Government Health Institutions will be counted among the professionals who brought innovation in health and safety and the environmental issues to enrich Ghana's businesses, workplaces, the oil industry itself, as well as the lives and the working people of this country, as well as the adjacent communities that surround the places we work. So with this, I will encourage you to carry on with these lofty objectives, which are listed in your vision and mission statement. And I wish you very, very happy and productive deliberation throughout the day in your second annual general meeting. Thank you very much.
Invite Dr. Ms. Rebecca Quasi to give us a bit of thanks.
As it's getting more interesting, we just have to, end it here. We would want to say that without God, we wouldn't have been here. We thank God for making this day a successful day and for this program to come to this point. Without Him, we wouldn't have been able to do anything. So we are grateful unto God. Secondly, you would agree with me that we owe a very special thank you to our chairman, Dr. Kweno, our guest speaker, Dr. Opoku, and our special guest of honor, Dr. Apia. They've really opened our minds, and there's a lot of thoughts in our minds right now as we go away from here. And we also want to say a very thank you to the president of GAQHI, the executive members, the secretariat, and the members of GAQHI for setting this pace for Ghana. Today, I'm sure it's a very special day that will be remembered for setting this pace, and we hope that we will live up to expectation. We would also want to say thank you to all the members who are here, to the press, and to all the invited guests. Thank you very much for coming, and we hope to work together for Mother Ghana. Thank you.
Section Odu. All those who have passed through the GAQHI program on occupational health, I think know him very well. We brought him on board because of the nature of the theme for this particular AGM. Mr. Odu is very popular, and I don't know how to introduce him. It may be a long, how many pages? The CV about 10 pages. I'll make it short. He's a lecturer in occupational health and safety with GAQHI. Mr. Odu, you are welcome. Thank you.
Thank you. The topic you have chosen, you know, is a very broad one, and I will not attempt to exhaust everything, but I'll do my best. Cases that are associated with accidents when safety, health, and environmental issues are not taken seriously. The oil industry is without exception. Well, we all know, we are happy Ghana has discovered economic quantities of oil and gas, and we are poised to join major oil and gas producing countries very soon. That is a very happy news. We are all making preparations to ensure that the country derives maximum benefit from the newly discovered oil and gas industry. But there is caution. A very important area that must not be overlooked during this preparatory period is the issue of sound personal safety, health, and environmental management. The health and safety issues, as I said earlier, affect every industry. Consequently, for an organization to grow and prosper, it must take safety issues, health issues, and environmental issues seriously and manage. The oil and gas industry know that it's highly risky in terms of safety, health, and environmental goals. And therefore, we must not only be thinking of how to manage the income which is going to come from the oil and gas industry, we must also be thinking of how to protect that income from becoming eroded through one single accident. So the question now is, what is occupational health and safety? It is a discipline in broad scope involving many specialized fields, and its main aim is the promotion and maintenance of the highest degree of physical, mental, and social well-being of workers in all occupations. At times, we lay emphasis on the physical aspects. We are looking for injuries that cut people, and we forget about what can affect somebody's mental attitude towards work as a result of the stresses that he or she undergoes. Occupational health and safety practice requires the collaboration and participation of government, employers, and workers in health and safety programs, and involve the consideration of issues related to occupational medicine, industrial hygiene, toxicology, education, engineering, safety, economics, psychology, and so forth. So in every part of the world. Our so-called developing countries are the worst off. The reasons are not far-fetched because we are not motivated in any way to apply this thing that the industrialized countries apply. Something which started to be in this country is that when we go to plead with investors to come and invest in this country so that we can get work for our people, I don't know whether the people who go there to woo them tell them that in this part of the world you can come and do anything and go without caring for the health and safety of the people. If you go to most of these free zone companies, it's a woeful and pathetic thing. Workers are being treated fairly. Workers are made to walk several kilometers to their places of work. They are not even given water to drink. No place of convenience. If you are sick, you are marked absent on a day. So something must be done. These days, what they give us at our places of work is not sufficient. Some people will have to do extra work somewhere to supplement it. If you are sick, you may be given your normal salary for some months, but you cannot do overtime, or you cannot do any extra job anyway. So your income is diminished. And if this persists for a long time, you may even lose your job. Your employer will continue paying you after some time. You say, well, you cannot recover, so I am terminating your appointment and I'll give you some money to go and live and die. The health care costs associated, although you may be taken care of by your organization, there are certain things that they cannot do for you. They cannot heat water in the morning and carry on their heads and come and give you. They leave you there. It is your wife who is going to take a bucket of water and bring it to you at the hospital. That is if you are a man. The women, I don't know who carries the water. At times you need to replace the injured worker, which requires that you retrain somebody. And it takes some time for that person you have trained to be competent to do the work the injured worker will do. Time must be devoted to legal requirements that you must investigate the incident. And people will have to write reports. Some people will have to answer questions. What really bothers me when an accident happens is that if it happens in your department, you meet somebody and he asks you, how did it happen? You take your time to narrate it. The moment you move to the next person, he asks you the same question. So for weeks, you are answering the same questions. So what time are you using for that? How can you account for the time you are using to narrate the accidents? It's unprofitable, and therefore it is going to erode your gains. Certain hazardous jobs like working on high voltage equipment, pressurized equipment, then you must make sure that there is a log out and tag out system where the person going to carry out the job actually isolates a valve or de-energizes the equipment and locks it and puts the key into his pocket. And the maritime authorities should be notified of the schedule and location of activities when there will be a significant increase in vessel movement, such as during facility installation, rig movement, and seismic service. I hope that kind of collaboration is going on between the Navy and the people who are operating there. Ideally, every organization, no matter how small you are, should develop emergency preparedness systems. Because at that time, you don't have time to think and say, Kofi should go and do this, or you should go and do that. You only activate the emergency procedures. That is lacking. The team should coordinate actions with other agencies and organizations that may be involved in emergency response. So again, this is a teamwork. Let people who will come to help you in emergency know the procedures that you are putting in place. Let them participate even in your drills. Activities such as offshore drilling and pipeline installation, seismic operations, and decommissioning may result in temporary impacts on other users of this. For those of us who are in a position to influence this kind of things, should try to influence it so that it happens. We do not necessarily need laws to be able to do this kind of thing that I'm saying. But without the law, some people will never act. The laws that we have now, the penalties that are attached are so woefully inadequate that I can decide to flout them and pay peanuts. It shouldn't happen. If it happens in the oil and gas industry, the things that we are anticipating, we will never get. I can assure you.
Thank you for expanding our knowledge and understanding of the issues on occupational safety and environment. What I wanted to find out from you is, now that you've been introduced to GAQHI, I know you have challenges for many years in trying to get some of these issues to do you think you can work with GAQHI? Not you as an individual, but those few of you who are in the area of occupational health and safety. Because GAQHI involves, at least contains, people who can interact with you at a certain level of understanding in these issues. And they come from some of those company and institutions which you can work with. So that if you pick some of these companies, you can start implementing some of these measures and then extend it out. I'm just wondering whether you think there's a role of GAQHI in liaison with those of you who are in the area of occupational health and safety to come to